Afrika is joining me to dissect President Cyril Ramaphosa's address. He's the acting Deputy Vice Chancellor for Research and Innovation at the University of KwaZulu-Natal, Professor Musa Mashabela. Also joining the conversation is the National Liquor Traders Council convener, Lucky Ntimane, Free State University Chancellor Professor Bonang Mohale, and political analyst Sanusha Naidu. You're a part of this conversation tonight on WhatsApp with your questions and your comments, 072-110-5584. You can tweet us at Newzroom 405. The hashtag tonight, hashtag roundtable on 405. Good evening to you all, and thank you for joining us tonight here on In Focus as we address the issues that were raised by the President tonight. Prof. Musa Mashabela, let me begin with you. When we are looking at what the President announced today, are we seeing new information in how the virus is spreading, or is there a fundamental difference in what we are seeing right now?
Yeah, good evening, Thabo. From the speech itself, not so much. I think there was a recognition of the burden of disease that we currently have in terms of COVID-19. There was a recognition of the fatigue that South Africans are basically experiencing, a recognition of the drivers of infection, particularly the social gatherings. But beyond that, I think that there were other things that could have been acknowledged, specifically issues of the variants, because those tend to relate a lot to issues of borders and border control, and those were not addressed in the speech, and also issues around elections and electioneering, which is something I think we are aware is being addressed, but also that really could be an important driver of infections. Other than that, I think that we've had the usual. The key contextual issues were not really addressed adequately in my view.
All right, let's talk then about what science says. I mean, it seems the idea is that let's ban movement and gathering after 11. And I've heard people argue that it's as though we are saying the virus behaves differently after 11 than it does during the day.
No, well, I think it's more an issue of alcohol use and parties, and the fact that there is disinhibition of behavior when it comes to those kinds of gatherings. But again, I don't necessarily think that those are the only drivers of infection that we should be looking at. I think it's important to address them. I think also it's difficult to enforce sort of regulations and restrictions during that time of the night, I suppose. But in general, even during the day, we in alert level 1, we haven't been very successful in enforcing adherence to restrictions. So I do think that it's a combination really of behavior on the one hand, but also issues of enforcement on the other hand.
So exactly on that question of behavior, the fear is that we are, of course, limiting social gathering after 11 on the outside, where it would probably be better for people to be outdoor, but we are now bringing them inside. So a lot of them will take those social gatherings inside, and that would be where the spread actually happens.
Yeah, and I think that in general we should be, if we are being honest from an epidemiological point of view, we should be banning many of those social gatherings, whether it's during the day or during the night, because of the weather also. It's cold. People will gather inside. Sometimes even during the day, people will gather inside. So if we are serious around crushing the wave of the third wave and making sure that we can survive this third wave and have a better November, December time later in the year, and while we roll out the vaccines, we do need to be a little bit more aggressive. But I recognize the caution that the president was expressing in his speech. That has to do with the fact that much is expected of South Africans, and it's difficult for government to ask for more from South Africans. On the other hand, I think that the president is fully aware of the fact that they want to maintain economic recovery. So there is a very fine line that the government seems to be trying to tread, which is very difficult from their point of view. But from our side, epidemiologically, we would wish that we could do everything we can to crush that cap.
Like in Ntimane, the ban is pretty much around time. I don't think it's really on off-site consumption as much as it is on on-site on-site consumption and limiting the time in which those establishments can sell. The president saying now bars and likes will now need to close at 10 p.m. Would you expect that to have a severe impact on the traders?
Good evening, Tabo, and good evening to Newzroom Afrika viewers at home, and also to the esteemed panelists. Look, in the main, we welcome the president's decision not to place any restriction on the sale of alcohol. However, we take cognizance of the curfew that was placed that is obviously going to eat in the time allowed by our traders, most especially the pubs as well as restaurants. But we feel that, Tabo, we've got a role to play as liquor traders. So that hour that we have to sacrifice, it's worth it. We are willing to give that to government as we all gear towards fighting this pandemic together. Our members have gone the extra mile to ensure that there is full compliance with all the COVID-19 safety protocols. And we remain committed to support government in the fight against COVID-19. And we feel that, allowing licensed businesses to continue operating reduces the opportunity as well for the illicit trade to flourish and allows the legal industry to ensure that alcohol is consumed in a responsible manner. But furthermore, Tabo, and important, we call on all our liquor traders, our customers, and the public at large to remain vigilant and adhere to all the COVID-19 safety measures. We must all play our part to make sure that we defeat COVID-19 pandemic. So in the whole, we welcome the president's address, and we are going to rally behind this call to ensure that together we are able to defeat this pandemic.
Right. I mean, the announcement, like you're saying, the Free State, the Northwest, the Northern Cape and Gauteng having reached the threshold of a third wave of infections. In fact, saying in no time he believes that the whole country would be at that particular level. And this sustained increase, when we look at it, is attributed to the size of gatherings, social gatherings in particular, that involve the consumption of alcohol. Would you say it's only a matter of time that the president would want to revisit the situation of the sale of alcohol?
Look, I think as an alcohol industry, we are not used to being the whipping child of any interventions that government wants to implement with regards to deal with COVID-19. But we like to caution against any decisions that are made not taking any scientific approach. Hence, we have called on government to really engage with us so that we can look at more practical solutions and not just a blunt object of banning, and restricting the sale of alcohol as a measure that government thinks that will somehow magically make COVID-19 go away. So we really believe that, the issue of congregations as well as people coming together is not really an isolated alcohol industry issue, but it's a general society issue that we all need to confront. Really relegating this to an alcohol issue becomes an unfortunate conversation to have. But we are ready to do our part as the alcohol industry, as a travel sector, to make sure that in our midst, we are not seen as the carriers or the motivators of super spreader events or behaviors. So we will do our part, Tabo, but we really take exception to a notion that seeks to put the alcohol industry at the center of the rise in the number of COVID-19 cases, especially now in the third.
Mohale, key economic responses from government so far, are they taking into consideration in terms of their impact on the human and economic aspect of things, and have they responded adequately?
Tabo, it was always going to be about saving lives on the one hand and preserving livelihoods on the other. Therefore, the president and the National Coronavirus Command Center needs to be congratulated for only relegating us to an adjusted lockdown level 2. It could have been worse, because we are where we are as a direct result of our own behaviors. The super spreader events, some people have conveniently forgotten that we were still in lockdown alert level 1. However, we have always contended that the government has done its part in terms of socio-economic stimulus, 500 billion of TERS. Now we are lobbying very hard on TRIPS. But remember, we have always said that the vaccine rollout was always going to be about competition. And this is where our behaviors are not demonstrating beyond any shadow of doubt that actually we are far lagging behind. When you look at the global stats, for instance, globally we are talking about 170 million total cases, 3.53 million deaths In South Africa here, 1.7 million people, again, total cases, and the people that have died, 56,363. Therefore, both the morbidity and mortality is increasing. South Africa being at a COVID rollout of 1.2%, we are actually not doing too well, especially when you compare ourselves with 11 countries that have already vaccinated 100% of their own population. The president has set us a herd immunity of 67%, the total adult population, that's 40 million South Africans. And in January, we rightfully said we need to inoculate 100,000 a day every day.
Yeah.
Minister of Health says by the end of March, 1.2 million frontline workers. We missed both of those. In fact, where we are today, the president says we are approaching 1 million at 970,000. 1.2% is not sufficient. It was always going to take us 400 days, 13.3%, 13.3 months before we get to that herd immunity. Now we have 29 African countries that are ahead of us, only 26 that are behind us. 22 countries have already opened to those people that are already vaccinated. Their tourism is going ahead. You and I cannot even support our own tourism industry that pre-COVID was 9.8%. Now in COVID, it's 7.3% and going down that data.
Yeah, indeed. Sanusha, with the virus spreading so rapidly, is the president bold enough to say to his comrades, stop showing up in huge numbers and thousands of you outside courts supporting people who are appearing there who should actually just be appearing on their own?
Good evening, Thabo, and to my colleagues and the viewers. I mean, I was waiting for that question just as everyone was speaking. How do you control your own party and expect the South African public to control themselves? But I think it's definitely a challenge. It's a challenge not necessarily around the question of how do we create self-reliance or self-restraint, but rather it's a question of what are the bigger political stakes here and the complete disregard for not just the integrity of the issues that are being debated in the party and discussed, but also in terms of the recklessness that demonstrates to whether you bus in people from all over the country and you bring them there for a particular political spectacular show, which has nothing to do with what is the real issue. So the risk factor in that kind of gathering, I'll be very interested to hear, because somebody could argue that it's an outdoor event. It can actually meet the numbers in terms of an outdoor event. But at the same time, there's nothing in terms of how do we go forward to say that you are creating risk. So there's the whole question of how risk can be mitigated and whether the president is able to deal with this in the sense that, as he rightly said, tonight, that we have to be vigilant, we have to have some kind of self-restraint, we must also be collective in our responsibility. But then I was waiting for the fact that somebody needed to point out that in his own party, all of those characteristics seem to be lacking. And unfortunately, the buck stops with him because he's the president of the party. But I just want to come back to a few other issues in terms of the speech he presented and the briefing he made. I mean, I think what we also got to remember is
Sanusha,
that
I want to come back to those issues
every time.
I want to come back to those issues when we return from the break. So do stay with us and keep those in mind. Professor Musamo Shabela, Sanusha Naidu, like Intimana, as well as Professor Bonang Mohali. Right back with you on In Focus here on Newzroom Afrika, channel 405. The conversation continues. Mitigating measures announced by the president to curb the surge in COVID-19 numbers. He says in the last 3 to 4 weeks, in fact, we've seen a proportion of positive tests doubling. And if you look at the daily infections, if you look at them a week ago, it is now 37% more than it was. In fact, 66% more than it was 2 weeks ago and 37% more than it was just a week ago. So there's been this sustained increase, and therefore now putting the nation back into lockdown level 2. Reduction in the number of those who are allowed to gather, but also some limitation in terms of the curfew moving now to 11 p.m. To 4 p.m., which means certain establishments will now need to close at at 10 p.m. to allow those who work there to be able to get home before the curfew kicks in. Professor Musa Moshabela with us tonight, Sanusha Naidu, Lakintimane, and Professor Bonang Mohale. You're a part of the conversation on WhatsApp as well as on Twitter. So Sanusha, you were saying you wanted to touch base on some of the other issues we were raising, particularly around the vaccine rollout, but also the interventions that the president announced tonight.
Yeah, I mean, Thabo, it seems as if we're going through a revolving door all the time. The moment we think that we are in a process where we've, I wouldn't say even flattening the curve anymore, where we seem to have a relative stability, that the infection rates are not at that daily level of over 5,000, that we kind of in a kind of relative normality, if you want to call it that, then we go into a more relaxed version of a lockdown measure. But then the moment we see it increasing, we go into a heightened level of activity in terms of what is adjusted levels of lockdown measures and regulating the lockdown measures. Unfortunately, we're not dealing with more of the issues, of the structural issues that are confronting our society, confronting our economy, confronting the way in which we do business, the way in which we actually structure the labor market, and more importantly, we're going to keep going into this ebb and flow, a constant kind of reaction to the pandemic as it becomes more kind of life-threatening, and we get caught up in these binary issues around the problem here is that people are always going to be at risk, no matter where they are, in the economy, in their social constructs, in their homes, etc. And I think to a large extent, we're going to probably have to live with this for the next couple of months, if not several months, because we don't know what's going to happen to this pandemic and this virus as we move out of the winter months, into winter months, out of winter months, into spring. It seems to me that we kind of caught in a bit of a reductionist issue here in terms of the way we react to the virus in terms of lockdown measures. And I'm not sure whether South Africans have the mettle, the patience, and the patience to continue in this kind of process. But again, these are just my interpretations of things that we haven't really resolved in terms of our structural conditions in society.
Have you exhausted all our social safety nets? That's the question we'll ask next as this conversation continues with Professor Bonang Mohale, Professor Musa Moshabela, Sanusha Naidu, as well as Lakintimane. But first, though, let's get reaction to President Cyril Ramaphosa's address. We take you live now to Soweto, where Newzroom Afrika's Zniko Mhlaba is standing by for us. Zniko, what are the people saying to the president's announcement tonight?
Well, Thabo, as you've rightfully said, initially in the previous crossing we were at Pimville. We're back now at Vilakazi Street, where most people are saying, well, some are concerned, some are not concerned at all about the curfew hours. Well, I've got Umkolisi, who's a resident here at Vilakazi Street. He's going to give us a sense whether he's worried about the new curfew between 10 and 4. Umko, kunjani bafa?
Ngiyaphila khotmani.
Umko, upresident manje uthi i-curfew between 10 and 4 o'clock. Wena njengomuntu ojwayele ukuzochila lana uzizwa kanjani ngaleyo nto leyo?
Mina nginankinga khotmani se personal mina ngi-affect total maka sengicabangela abantu abakanamabhizinisi khona la kule strata ngoba nayisla effective kakhulu la. Yibo abantu abazo-affecteka.
Okay, njengomuntu okhonzima ama-product adayiswa lana ngiyasho ukuthi amabhizinisi alana azaw-affecteka kakhulu. Yiwaphi mhlambi izinto ocabanga ukuthi ugovernment ngabe uziconsiderishile uma unga-advise lamabhizinisi aphusha lana, nga-advise ukuthi a-adjuste kanjani?
Erentsha manje internet online the best way because online 24 hours for sure.
Okay, thank you. Okay, that was Mkolisi. So Mkolisi is basically saying, Thabo, it's about time that businesses around here in the township should also consider going online, because the digital era is the new way now of marketing and also making sure that you are getting your product out there. Well, that's how things are. People are driving back home now. As you can see, the cars that are driving down the Vilakazi Street. A lot of people, some shops are closing down as well. So generally, Thabo, people are happy and people are not concerned at all about the new regulations, because they are saying they've been adhering to the regulations of government. Going forward, they are suggesting that it's about time that government considers all the other issues that business people have been talking about, especially the issue of making sure that the messages do trickle down to the people on the ground, especially when it comes to making sure that people do have access to internet.
All right, Nico Mhlaba, thank you tonight. Live for us out in Soweto. Reactions there coming through to the President's address tonight. Still with me, Professor Musa Moshabela, as well as Prof. Bonang Mohale, Lakintimane, and Sanusha Naidu. Prof. Moshabela, what are we waiting for? We are waiting for clearance from Johnson & Johnson. This is part of the reason why we are only seeing limited number of vaccination sites being open, but generally also limited number of vaccines coming into the country. And are we only limited to those two? Why is there seemingly a preference for those two more than the others?
Yeah, I think, Thabo, firstly, the preference has to do with the confidence we have in the vaccines. I think in South Africa, we went out of our way to basically settle for vaccines that we trust will work locally with the dominant variant that we have here. And that's the Johnson & Johnson vaccine that we have tried and tested here. And we have confidence in that. But Pfizer also, we have confidence in it. It was tested in 800 people, and in whatever other tests that were done, including laboratory, it was shown that it will work against the variant. I would say that that's the main preference. And otherwise, those two also, we have enough doses for them. The 31 million and another 10 million people, potentially another 5 million from the Pfizer. And so we can adequately cover majority of adults. So in a way, the vaccine doses is really not the issue anymore in South Africa. It's more about how do we get the jabs in the arms. And I think that, it's true that Johnson & Johnson has limited the process of the rollout, but not as much as, not so much. It's not really a big issue in terms of, increasing the sites and the doses here in South Africa. It's more an issue about how to get into rural areas. The hope was that strategically, because it's a single dose, it requires only a normal fridge. Supply chain doesn't need to be that cold. It can get to rural areas. Pfizer is difficult, a lot more difficult to get into rural areas. But we are not exhausting all the doses that we have currently. We've only given out 900,000 doses, and probably half of that based on Pfizer. And we have maybe another, I would say 800,000 doses of Pfizer that are currently available in the country that we have not given out. And tonight we are getting another 636,000 doses. So, in my view, the first week we gave an average of 30,000. The second week, that's just ending an average of 60,000 every day. In my view, I think that there's nothing that stops us in the coming week to give an average of 120,000 doses every single day in South Africa. And if we start pushing like that, then we'll get to a point where we are getting closer and closer to giving 200,000 doses a day. And that's what we need to do in order to instill a push in our vaccine rollout, have a sense of urgency behind the rollout, and that will really protect people from severe disease and death, which is really the goal, including now in the third wave. We have to try as much as possible to protect people from severe disease and death.
Lakintimane, you've previously written that poverty is the disease. Are we doing enough to stop the surge of poverty that is affecting many lives in South Africa because of this pandemic, particularly around the safety nets that we have? It seems we have really, at this particular point, used up all the safety nets that we have. Are they still holding? And the only option that seemingly is left to us is to keep this economy going at all costs.
I think, Thabo, the fact that we've been allowed to operate, for us, that is the vaccine that we need to survive as liquor traders. This gives us an opportunity to pick up the pieces and be able to be on the road to recovery, to continue supporting our families and the livelihoods that are dependent on the alcohol industry. So we feel, hence, we are supporting and welcoming the President's announcement that there will be no restrictions or a ban on alcohol sale, because that is essentially our vaccine. As we know, there is no poverty there is no vaccine for poverty. So, but we feel that we have been given, that extra lease of life by the government to be able to continue supporting our families. But this is not to say that we need to let our guard down or really take this to say that COVID-19 is no longer there in its severity. But it's just to say that government has put its trust on us as liquor traders, us as liquor manufacturers, to continue the work of supporting government's efforts in making sure that we fight COVID-19 pandemic. We need to ensure as liquor traders that our places are a place of safety, are places that support, issues of mask wearing, as well as ensuring that we sanitize all people that come into our places of entertainment, as well as ensure that we are able to follow the guidelines of curfew, as well as ensure that there is social distancing. So we take this as a full responsibility and a vote of confidence by government on an industry that has always been the whipping boy by government. So we accept, that this responsibility is something that we are able to grab with both hands and be able to run with it as we continue to support government's efforts to ensuring that we stem the tide of the table.
Prof. Musa Mashabela, UKZN Acting Deputy Vice Chancellor of Research and Innovation, Professor Bonang Mohale, University of the Free State Chancellor, Lucky Ntimane, National Liquor Traders Convener, and Sanusha Naidu, Political Analyst. Hashtag tonight is hashtag Roundtable on 405. The conversation continues with our panel tonight. So Sanusha, how does the Digital Vibes saga and the handling of that impact on the integrity of our intervention?
Yeah, I think that's something that you can't shy away from, particularly the fact that the health minister is allegedly implicated in terms of the scandal. I think the president has also indicated that until he receives the SIU report, he'll then make a pronouncement on the issue. But it does kind of take away from what has been in difficult circumstances and situations. What has been the healthcare ministry's intervention, the Ministry of Health intervention. I mean, the minister has been hands-on, he's been on the ground, he's been visiting, he's been giving the updates. And I think in a way, this whole scandal now kind of shifts the focus away from some of that. It raises the question of whether or not there should be some kind of action taken. I think that in itself also raises questions about how this health ministry will go forward in terms of the integrity, the questions around the integrity of the situation regarding the health minister. But again, at this point in time, when we think about the scandalous behavior with the irregular tenders that have afflicted the rollout of the PPEs, and what we're beginning to see as money that was spent in such an irregular and reckless manner, I think you can't shy away from the implications and the parallel optics that this scandal has for not just for the ministry, but for the state itself. And I think in public opinion and in public discourses around the country, whether you're on social media or whether you are sitting in your home having a coffee, you would essentially be talking about this and asking yourself, is there something here that we need to be guarded about? So you can't shy away from it in all kinds of optics and spaces.
Dr. Mohale, consistency in leadership in a time of a pandemic, I suppose quite crucial here, so that when the president makes an announcement or he sounds the alarm, the nation is able to take the president seriously because the president is consistent in how he applies his sanctions or his measures in dealing with those who are communicating and who are tasked with the task of officiating, particularly this fight against the pandemic. How do you see the scandals that are playing out around his cabinet affecting the work that the president would try and do in protecting the nation, protecting the economy, and make sure that we fight this pandemic?
I think it further weakens and exacerbates the lowest levels of confidence, trust, and hope since the Second World War. And for me, it talks to the last of the four foremost overriding priorities by the sitting president, Madam Cyril Ramaphosa, when he spoke about defeating the coronavirus pandemic as the first priority, the second being accelerating our economic recovery, the third being implementing the economic reforms in order to create sustainable jobs and this notion of driving an inclusive socio-economic growth. And of course, lastly, he spoke about fighting corruption and strengthening the state. As business, we have been very consistent in saying people cannot steal like they did in the last 9 wasted years without consequences. Therefore, we must take the top state capture miscreants to jail. We have said, of course, as business will help in securing the vaccines. We have put together business for South Africa. There is a COVID communications arm that was manned by 135 individuals. 35 of them are still absolutely active. We said we needed to reduce the government debt. We said we needed to increase our infrastructure spend, especially in fixing our ports. The KwaZulu-Natal Durban port was really congested, but also in households, but also in roads. Lastly, we said we needed to fix our more than 740 state-owned enterprises and state-owned companies. Why are we not completing the auctioning of the spectrum to bring back the loss of faith? It is truly beyond me. All of those put together, that's what, like the share price of companies driven by rumor and speculation, need to send a consistent message about a wartime CEO that is decisive, that is absolutely explicit about what is right and indeed wrong.
Professor Mushabela, let me bring you in here and get a sense from you. Did the message by the president indicate how serious the situation is? And the fact that he did not touch on the variants, the fact that he did not present a sense of urgency in how we are ramping up this vaccination process to at least 120,000 daily jabs on the arm. What does it tell us about the seriousness of the situation?
Yeah, no, Thabo, I think that's an important question, and I think that the president stated the facts on the situation, but I cannot say that he expressed the kind of seriousness that I was hoping he would express. And part of it, I think it's got to do with the fact that, behind his message, he is being very apologetic for the measures that government is taking to increase restrictions, which for me, I think have to do with the fact that once again, the national response has to depend a lot on South Africans basically cooperating with the measures that need to be put in place in order to limit transmission. I do think that if the president was coming in with a stronger hand that has to do with an accelerated vaccine rollout program that has already kind of covered 10-20% of the country, if the president has come in with without all of this sort of scandals that are being discussed here on this roundtable, I think the president would have come out with a much stronger message to say that the citizens need to take responsibility for their part, given that government would have been playing its part. When government is not seen to be playing its part accordingly, it makes it difficult for the president to also come out with a strong message. I do think that my hope is that this is not the last speech that he gives to the nation, and he shouldn't take too long before he comes back to address the nation, because I do think that those messages, including his gentle approach of basically showing sensitivity and understanding in terms of the struggles that people have, could really help get people together, especially the different sectors, different political parties. Everybody needs to be behind the nation in terms of crushing this wave while we are still trying to accelerate the rollout. That, for me, I think, Thabo, would really help us through this difficult time for the next couple of months that we're going to face.
One would say apologetic, on all fronts. Even on the EVDS system, President quite apologetic on the glitches that system is currently experiencing, which makes for the overall experience of being vaccinated to be unpleasant.
Absolutely, Thabo. The EVDS has been a major disappointment for a lot of people. I think that in many respects, for some of us who kind of went through the Sisonke study and vaccination, we've also seen how that application that was used for Sisonke worked pretty well. And it begs the question, if you can make one system work, why can't you make this other one work? And I don't think that South Africans are unreasonable in demanding a functional system. And also, I think that the Department of Health is trying to carry this whole thing on their own. They shouldn't. There is no expectation from us as South Africans for the Department of Health alone to carry the vaccination rollout program as a whole. We need everybody. We need all sectors of government. I don't know why we are not asking the alcohol industry, Mr. Ntimani, to help with getting vaccines in all sorts of corners of this country. They have a lot of experience in terms of their supply chain, I would assume. But I do think that we need all sectors of society, all government sectors to help with everything that needs to be done. If this is the most important project of the year for the country, why is it that we have a dysfunctional EVDS? We've got such smart, expert people in this country. It's not possible. Somebody is just not doing what they're supposed to be doing. We shouldn't be experiencing that. And that makes the experience quite unpleasant for everyone who has to go through it. Now, we have to open ourselves to walk-ins. Walk-ins are so difficult to manage, but it looks like for now, for the time being, it will be the only way we can get jabs into arms, because people cannot keep waiting, not knowing when they have to go and queue up. And we need to manage our doses, and sites need to know how many doses they need to have, but we cannot necessarily create super spreader events in those facilities. And in my view, we shouldn't really even be vaccinating in hospitals. We should really be vaccinating in communities, closer to people. So, Thabo, we really need government, especially government as a whole, not just the Department of Health, to realize that it's important to make sure that we bring everybody on board in driving the vaccination rollout. This is the only way we win here and we get back to some degree of normality.
All right, In Focus continues for you here on Newzroom Afrika, channel 405, with your WhatsApp messages tonight at Newzroom 405. That's where you are on Twitter. Otherwise, 072-110-558 for our panel. Stays on Professor Musa Mushabela, Sanusha Nadu Lakintimane, and Professor Bonang Mohale. We're back in a moment. Right, we're back with you on In Focus, and our conversation continues tonight with Professor Musa Mushabela, Sanusha Nadu Lakintimane, and Professor Bonang Mohale. Let's have a look at your WhatsApp messages coming through tonight from Hammanskraal. This one is from Timothy saying, the government should have vaccinated a large number of the population before easing the restrictions rather than doing a trial and error kind of a thing. Letabo in Midrand saying, if the president is serious about flattening the curve, we're supposed to close the borders from India a long time ago. He's just playing politics and doesn't care about the people of South Africa. Prof. Musa Mushabela, let me start with you on that question of we should have vaccinated first before loosening the restrictions. But also there are some who are saying, actually what needs to happen is let this virus run its course, because a large number of those who are infected don't actually get seriously ill, and those who have been ill have survived?
Thabo, we came from the second wave. And from that experience alone, we should know that we don't want to let infections run rampant. Let's not debate that one. I think that anyone who may be making that argument, they can make it philosophically. But the reality of it is not anything that anyone wants to experience, especially when it hits close. We don't want to experience that. So let's put that one aside. I think there is an issue here that has to be acknowledged and addressed. And this is about the fact that government in South Africa could have rolled out the vaccine earlier. And we recognize that. But AstraZeneca Oxford vaccine was brought in time after we made a lot of noise in December for government to procure vaccines. But we know at that time that when we were just about to start in February, then we encountered the problem of the variant escaping this vaccine. So government, that caught government offside. But fortunately, South Africa has a strong scientific community that was able to bring the issue of Johnson & Johnson on the table with donations from Johnson & Johnson to start the Sisonke study. That was not necessarily the original plan, but it helped to try and protect some healthcare workers in terms of, and then on top of that, we had side effects from Johnson & Johnson, and we paused for about 2 weeks. So the issue of the AstraZeneca vaccine, many of us did not agree with the decision government made. We accepted it. The issue of the Johnson & Johnson, we did not agree with the pause for 2 weeks. We accepted it. All of those things were done from the government's point of view as a way to ensure safety, to ensure efficacy of vaccine, given the specific challenges we have in this country. So we can accept some degree of delays that have happened. We are here today. We don't have Johnson & Johnson from Aspen because of things that are relatively beyond the control of government. But we are saying that with the doses we have currently, let's make sure that there is a sense of agency in putting them into arms. There's a lot of people who are waiting on the sidelines to make sure that they can get those vaccines. Let's do that. The people who started vaccinating 2 weeks ago will only need a second dose at the beginning of July. All the vaccines that we have can be used as first dose vaccines for the people that are waiting to be vaccinated, especially the people who are at the highest risk of infection. We have to move fast here. We don't have time to waste. If government can explain and justify all the other reasons why they had to be delayed, this one will be inexcusable, which is why I'm saying that government needs to make sure that we double the doses, and as much as possible, we move close to 200,000 doses per day in terms of making sure that jabs are getting into arms. We will be monitoring the rollout based on doses that are given per day, not necessarily based on what we are going to achieve at the end of June and end of July, because every day, one jab in one arm can actually save a life, and that is important. That's what we have so far, until we've got something better. But right now, that's what we have.
Sanusha, talking of moving fast, message on WhatsApp saying earlier on that the speed at which we responded to the border situation with India will remain a blight on government's way in which they intervene. I mean, was there a way of responding quicker to that?
I'm not sure. I mean, I take a different view in the sense that you close the border to India, but you'll still have other multiplier effects coming through. If your ports are still open, you still have people that are coming, doing business in India, coming through third countries, still entering your country. So, the idea that you close the border, you do a hard border closure, is not necessarily one that's going to basically mitigate the risk of spread or infection or strain that's going to enter your economy or your society. I think the challenge is how, as Prof was saying, is how do you plan? That for me is the bigger challenge. The challenge is you had this second wave. You knew that they were going to actually have a rollout vaccination program. The problem is planning. The planning seems to be very much a weakened state of affairs, not just in the case of this pandemic or in this coronavirus. It's planning around the context of how do we deal with any kind of intervention in South Africa, whether it's the one thing we never spoke about is we're still going to see service delivery protests happening, irrespective of whether or not people are going to adhere to lockdown 2 adjusted measures of regulation. People are angry. They're going to continuously protest because their communities are in a state of complete disarray. They haven't received housing. Their communities are not in the state that they should be. And so they're frustrated, they're angry, and they continuously protest. So I don't know how you're going to deal with that situation, because a lockdown measure is not going to solve the protests that are currently we are seeing unfolding in South Africa in terms of service delivery. So closing a border, I think, is not necessarily the answer, but dealing with planning is what we are seriously lacking in South Africa.
Dealing with planning, like in Temane, have you offered, as the private sector, particularly the liquor industry, to assist in this rollout? Your fridges, the president mentioning today that one of the reasons why they cannot get to the rural areas is the question of having to keep the Pfizer vaccine at particularly low temperatures.
The alcohol industry is on record as having offered support in terms of logistics and storage for vaccines. As we know that, the alcohol industry is able to go into the armpits of the country where no one else can go. The alcohol industry can reach those places. And also back in June last year, the tavern sector opened its doors as part of, areas that could be used for testing and also for checking compliance in regards to COVID-19. So as an industry, we're fully opened up to government to partner to ensure that, we play our part in this pandemic. So I know that alcohol industry is also prepared, to support governments with regards to PPEs. We've also established a partnership with Santaco, where we are able to support them with PPEs as well as sanitizers to make sure that commuters are protected when they travel into Texas. So ours as an alcohol industry is really a long game in supporting not just government, but also society at large to make sure that we're able to stem the tide of COVID-19. So we are ready and prepared to assist government. All we're asking for is our government to talk to us, which they haven't done thus far.
Dr. Mohale, the government preferring to play its cards very close to its chest. Are they opening up to private sector in terms of where they are lacking and where they need help?
They could open up much more, Thabo. The private sector has some abilities and capabilities that are acknowledged globally. SAB delivers to twice as many shebeens as there are schools a week, where government cannot deliver once a year books to Limpopo. It makes sense to put these books in an SAB truck. The business sector has always said, we've got mines that were opened during lockdown level 5. We know how to deal with migrant workers, and we could inoculate them there. The logistics people in this country, in terms of Bidvest, which I am a part of, and Imperial, can move stuff around the country within 24 hours. The petrochemical industry, they sell 7.2 million liters of fuel a day, every day. They will be able to go to the 9 provinces. Why is it that we look at business as white monopoly capital when we're thinking radical economic transformation? The reasons why New Zealand defeated the virus is because when the Prime Minister stood to talk to her people, she said it will need all 5 million of us to defeat this virus. Right. But in South Africa, there are some people that are being marginalized. And the reason why business is marginalized, now we know, is because some of the people who call ourselves our leaders really want to steal. Right. Lastly, Dateta, our run rate should be 300,000 a day. Yeah. Because had we started at 100,000 a day in January, like I said, we were only going to finish in the middle of 2022. Yeah. So if we want to make huge progress, I agree totally with Ntate Musa Moshabela that I think we need to double so that we get to 300,000 doses a day. Because if we don't, and again, the medical aid industry, only 16.4% of the population belongs to medical aid schemes. They have a maximum liability of 7 billion. To them, it's only 2% of all premiums. We were already accepting and acknowledging that the major constraint to vaccine rollout. It's not the availability of vaccines, it's our ability to execute. I think that's where we are falling short.
Completely out of time tonight. Let me appreciate all of you for coming through tonight. Professor Musamo Shabela, Sanisha Nadi, Lakintiman, and Professor Bonang Mohale. And thanks to you tonight on WhatsApp as well as on Twitter for your engagement.